Our topic of today is EOV or extraordinary vessels. So what is the extraordinary vessels? Let's try to understand this here. The extraordinary vessels are the very special pathways, very special pathways of some vessels. The name itself is extraordinary. How many meridians we have in the human body? We are having total 12 मेरिडियन. हमारे शरीर में कितने मेरिडियन होते हैं? हमारे शरीर में 12 मेरिडियन होते हैं. But other than these 12, it become add 8 more. So 12 plus 8 become 20. And if we are studying all the 20 vessels, then our treatment will be very much effective. So during this workshop, during this upcoming all the classes, we are going to discuss these extraordinary vessels. Like we can see in this image, what we can see. We can see there is a dam with full of water. So the extraordinary vessels has been considered as a like a dam, like a ocean, like a sea, who are the reservoir of the too much water, who are the reservoir of extra energies. हमारे जैसे हमारी नदियों में पानी होता है, नदियों में रेगुलर पानी होता है, लेकिन डैम में कुछ ज्यादा पानी होता है. We can hold the water with the help of dam. We can have the great amount of the water in the ocean. In the same way, in the human body, we are having total 12 meridians. But other than these 12 meridians, we are having 8 extra reservoir of the energies. And these extra reservoir of the energies are called extraordinary vessels. इन्हें ही हम extraordinary vessels कहते हैं. There are many names has been given like the strange vessels, rare vessels, largest vessels. इनके बहुत सारे नाम हैं, अलग अलग नाम हैं, राइट? लेकिन इनका जो सबसे बेहतरीन नाम है, the best name is extraordinary vessels because we know, oh you are extraordinary. अरे आप तो extraordinary हैं. इससे पता चल रहा है कि we want to give some special title to someone, right? Extraordinary. Like we can see there are lots of policemen, but if we see the superintendent of the police, SP, so we can tell he's extraordinary. And there are many acupuncturists, but some of the acupuncturists are doing extra performance, so we are telling extraordinary. तो हमारे मेरिडियन में जितने भी पॉइंट्स होते हैं, तो वो कैसे एक्स्ट्राऑर्डिनरी वेसल्स का निर्माण करते हैं, वो हम अभी आगे देखेंगे. सो व्हाट इज द ईओवी? ईओवी का मतलब है कि द एरिया, द वेसल्स हैविंग एक्स्ट्रा अमाउंट ऑफ द एनर्जीज एंड वी कैन यूज देम फॉर सम स्पेशल पर्पज, राइट? नाउ लुक एट हियर. So there are 8 extraordinary vessels. 4 are superficial and the 4 are deeper. Superficial we can tell yang extraordinary vessels, and the deeper we can tell them a yin extraordinary vessels. So in this way, 4 are yin and the 4 are yang. So total 4 plus 4 is equal to 8 extraordinary vessels are there. तो 4 हमारी सुपरफिशियल लेवल की डिसीज को ट्रीट करती हैं. लाइक वी आर सफरिंग विद एक्यूट डिसीज, बैक्टीरियल इन्फेक्शंस, वायरल इन्फेक्शंस, एक्यूट प्रॉब्लम्स, ट्रॉमा. तो जब भी हम एक्यूट प्रॉब्लम के शिकार होते हैं, सो वी यूज यांग एक्स्ट्राऑर्डिनरी वेसल्स फॉर ऑल द एक्यूट डिसीज. एंड बट व्हेन वी वांट टू ट्रीट सम डीप रूटेड डिसीज, वी वांट टू ट्रीट some inner and the deep rooted disease, like we want to work on diabetes, we want to work on fatty liver, we want to work on the deeper level of the stomach problem, we want to work on the uterine problem, then we are using the deeper level of the vessels. They are the yin vessels. तो कितनी vessels होती हैं? 8. 8 में से 4 superficial or 4 deeper. 4 are superficial and 4 are deeper. Okay. So very, very beautiful sentence about the EOV. Okay, you want to treat the disease? क्या आप disease treat करना चाहते हैं? Yes, I want to treat the disease. Okay, treat the meridian or use any method. But if you want to treat the root, then use the extraordinary vessels. अगर आप बीमारी की जड़ को ठीक करना चाहते हैं, then use the EOV. In this way, whenever we are making the protocol, if we are adding spleen 4, pericardium 6, or the triple warmer 5, it means we are also working on the root. We are not only working on the branches. So meridian can treat the branches. Meridian can treat the disease, no doubt. Meridians are very much effective. But if you want to work on the root, then go with EOV. तो आपको EOV पर जाना होगा. Okay, am I audible very clearly? Just want to confirm. Audible? So now definitely when the patient coming to you, जब भी कोई patient आपके पास आता है, what's your target? Definitely your target to treat the disease from the root. I will give you an example. Like in our recent Gwalior workshop, some patients came, one patient came, he was suffering with the multinodular goiter. He was having goiter on the left side here, nodule on the left side. Okay. Then he was suffering, he was having left-sided neck pain. Okay. Then he was having left shoulder pain and he couldn't lift the shoulder. वो अपने shoulder को भी ऊपर नहीं उठा पा रहा था. Then he was suffering with the stomach problem, and we already know in the TCM, in the acupuncture, if the person is having some stomach problem, it might also reflect in the mouth in the form of pyorrhea, like stomach heat. If anyone is suffering with the pyorrhea, what is the treatment? As per the TCM, the treatment is stomach heat, is the treatment of pyorrhea, or the smell coming from the mouth. There is a problem in the gums. Then we are working on the stomach heat. If someone is smelling from the mouth, okay, then we target the stomach, because if stomach is in the bad condition, there will be smell coming out from the mouth, right? So the person came, he was having multinodular goiter and the nodule was on the left side. There were more than 2 nodules on the left side, left shoulder pain and couldn't lift the shoulder, left neck pain. He was having stomach problem and always suffering with some problem or the other with the stomach, left knee pain and pyorrhea. So what is this all? What is these all? ये सब क्या है? So we can understand they are the connections. ये सारे के सारे क्या हैं? ये सारे के सारे connections हैं. Suppose if patient is telling you, oh, doctor, can you treat my shoulder pain? Yes, it's definitely, I will put the point of shoulder. I will put some local point in the shoulder. Maybe I will take some back soup points. But whether we are able to treat from the root? So the answer is no. Because until and unless we work on the stomach, until and unless we work on the root, whatever the root, we will not able to treat the patient successfully. The disease will disappear, but after some time it will reappear. So whenever we want to plan the treatment of any disease, do you want to plan the treatment only for some time? Okay, you are doing the treatment, patient is feeling good, but after that disease coming back, then patient is telling acupuncture is working temporarily, कि acupuncture तो temporary काम करता है, बाद ट्रीटमेंट जब करते हैं तो ठीक लगता है, बाद में डिसीज वापस आ जाती है. Because if we are working on the root, then only we can treat the disease properly. So in this way, EOB is the very good way to treat the root. So suppose I want to treat this type of case, I will start my treatment from the spleen 4. We will learn why the spleen 4 is good for this condition. Spleen 4 will be working on the knee, will be working on the stomach, will be working on the shoulder, will be working on the neck in the entire chain. So that's why we are telling, if you want to work on the root, so treat the extraordinary vessels for maximum effectiveness. So you want to treat the disease, treat the meridian, but you want to treat the root, treat the extraordinary vessels. Now, one very beautiful thing about the EOV. When the patient coming to us with the structural issues, हमारे पास patient आते हैं suffering with the scoliosis. Okay, in the scoliosis, we can see how the spine turning on the side, suffering with the kyphosis. We can see here how the person is bending forward. Nowadays, has become a very big challenge. Because of the more mobile use, people are getting this kyphosis. लोगों को आजकल ज्यादा मोबाइल यूज, क्योंकि ऐसे देखते हैं, ऐसे बैठ के मोबाइल यूज करते हैं और टेढ़े होके लेटते हैं, आराम से टेढ़े होके ऐसे लेटते हैं, है ना? ऐसे. So they are suffering with the kyphosis. They are getting the kyphotic curve, and we have seen even previously we have seen many person who are bending forward. They are suffering with the kyphosis. They are suffering with the scoliosis. Scoliosis also very common problem. It was earlier also, and even it is today also. So how can we treat this? Because with the acupuncture, whether we can treat the structural problem, क्या हम acupuncture से टेढ़े मेढ़े स्पाइन को, टेढ़ी मेढ़ी बॉडी को, स्ट्रक्चरल प्रॉब्लम को भी सही कर सकते हैं? सो आंसर इज यस. सो EOV is the very wonderful method, and it's written in the EOV. If you want to work on the structural problem, then it is one of the best way we can plan the treatment. Many of you are working with EOV already, and you know, if the person is having short leg or the long leg, we are using some points and we can see the immediate change on a spot. कि व्यक्ति का पैर लंबा है, छोटा है, और आपने हाथ में एक पॉइंट लगाया, है ना, जैसे ट्रिपल बार्बर 5 लगाया, and you can see the immediate change in the leg length, right? So this is the one type of structural problem. Like for the normal person, it's very difficult to understand how can you change the length of the leg by one needle or by one point. And in EOV, it's not only necessary to put the needle. We have conducted many camps. हमने कई कैंप कंडक्ट किए, हम पार्क में गए. Only 8 magnets. Means not 8 magnet. For some person, we are putting only triple bubble 5, GB21. For some person, we are putting only 2 point like bladder 62 and SI3. And even by the magnet, we can see the on spot results. On spot, the effectiveness appear within the friction of seconds. And I will tell you, maybe today or tomorrow, you will learn that, right? So all the condition which is structural, like kyphotic conditions, lordotic condition. Kyphotic means person is bending downward. जब व्यक्ति आगे मुड़ जाता है, that is the kyphosis. Lordosis, ये सारी condition when the person is bending on the side, right? So these all condition we can treat with the help of EOV, right? Regarding the dystonia or the uncontrolled muscle movement, EOV work very nicely, very nicely. I will tell you, epilepsy, all the brain problems, multiple type of the issues which is connected with the nervous system, we are making the protocol using DU meridian. DU meridian, because DU meridian is going like this. In the DU meridian is the special indication that dystonia, epilepsy, and all the brain related disorders, we can treat DU meridian. And we know the master point is SI3. That is a discussion point will come later. Okay. So now, so in this way, structural issues are the very challenging problems, and with the EOV, we can work on the structural issues like the scoliosis, kyphosis. The person is having some problem in the sacrum. So because of the sacrum is tilting on one side, there is a long leg, short leg. यानी जब structural problem होती है, so we can work with the help of EOV. Now, whatever I am telling, I'm not telling from my mind. I'm telling whatever has been told in the extraordinary vessels, not from today, since the 2500 years back. You know, there are the oldest Chinese books, that is Ling Su. In the Ling Su and Su Wen, there are 6 extraordinary vessels has been mentioned. उसके अंदर 6 extraordinary vessels का उल्लेख है in the Ling Su, the oldest Chinese text. Then after that, 2 has been added, right? So whatever I'm telling you, it is in the practice since thousand years, and just I'm passing that information to you. It's very clearly mentioned if you want to work on the structural problems, work on the EOV, right? And one great point, hereditary disease. Nowadays, we know it's a very challenging. Even sometimes it's impossible. That how can we plan the treatment for the disease if it's already hereditary? But the EOV, it's very clearly mentioned. Even you can work on hereditary disease. Definitely, as per my personal experience, I will tell you, sometimes we can work only till the little percentage on. We can't claim that we will work 100% for everything. No. It cannot be possible. But in the hereditary disease already, it's very clearly mentioned that EOV give better results than the other things, right? तो हम EOV के माध्यम से वर्क कर सकते हैं. Nowadays, many disease like the thalassemia minor, thalassemia major, and there are many other diseases like muscular dystrophy, and the genes are the many time disease appearing in the 3rd and 4th generation, right? Like maybe your parents were not having the disease, but the grandparents were having the disease. Now it's appearing in the grandchildren's, right? So hereditary disease might appear in the next generation and might be with a gap of some generation. EOB external vessels work very nicely for this purpose. Now, very good information next. We know we are having 2 types of energies, pre-heaven ki, which is stored in the kidney, post-heaven ki, which is stored in the our earth element spleen. EOB is very good link who is connecting pre and post-heaven ki together, right? So we are losing the kidney cells, we are losing the vitamin B12 or the different type of the vitamin. We can improve the kidney chi. Ultimately, what I want to tell you, we can improve the pre-heaven ki, which we are bringing from the childhood, and we can also enhance the post-heaven ki, which we are getting from the food. हम पोस्ट हेवन की को भी इम्प्रूव कर सकते हैं और प्री हेवन की को भी हम ईओबी के माध्यम से इम्प्रूव कर सकते हैं. क्विकली आई विल टेल यू, like see this. I have written for a quick reference here. Like see first one. Actually, we are going to discuss in the detail, but initially you should know what exactly EOV can do. So I'm telling you the table which will come after many days. Okay. What is written in the table number 1, upper one, spleen 4 and the pericardium 6. What's written? Heart, chest, and stomach. Okay, now take it very seriously. Heart, chest, and stomach. Person is telling you, oh, doctor, can you do something? I'm having heart pain. Can you do something? I'm having heart pain. Spleen 4, you put the spleen 4 on the master side and pericardium 6 on the opposite side. Heart pain will disappear. BP will reduce within the friction of seconds. Within the friction of seconds, it will not take more than few seconds, even not a minute. I will repeat. Suppose someone is telling you, it happened, maybe with some participants only during my workshop. One participant suddenly got chest pain and told me it happened in my workshop only. Doctor, today I forgot to take the high blood pressure medicines. My chest is paining. Do something. And even I was going to start my class. मैं क्लास चालू करने ही वाला था और ऐसा हो गया. Immediately I put the spleen 4 on the dominant side. We know what is the dominant side for the male. It is left. Pericardium 6 on the right side. Just even method, no tonification or sedation because it happened automatically. What do you think? How many minutes or seconds? It took only 30 seconds to fix problem. Only 30 seconds. So it's a very good. You want to read the heart problem? Okay, you can try many other points also. But you can start with the spleen 4 and which is the master point of the pericardium 6. Person is telling you, now I will tell you the example number 2, stomach issue. Again, see here, spleen 4 plus pericardium 6. Okay, fix it in your mind. Spleen 4 on the master side, pericardium 6 on the couple side. Okay. What is master side? What is couple side? We will discuss. If you don't know, we will discuss. But I think maybe 30-40% people will be knowing that. Spleen 4 on the left side for male. Person is suffering with a stomach problem. What is the stomach problem? In the normal language, what is the stomach problem? Maybe gas, maybe acidity, maybe diarrhea. Okay, we are not going as per the deeper thinking of the TCM that diarrhea is spleen, nothing like that. Think simply. स्टमक की क्या प्रॉब्लम हो सकती है? डायरिया हो सकता है, या फिर गैस हो सकती है, पेट में दर्द हो सकता है. Spleen 4, pericardium 6, you put and you see the result within 30 seconds to 1 minute. If your location is perfectly right. Suppose you are not getting the result, remove the point, put again, because sometimes maybe you are not putting on the right location. Maybe instead of spleen 4, you are putting spleen 3. Maybe instead of spleen 4, you are putting spleen 4.5, which is not recommended because your location of the point should be accurate. Whether you put in the body or in the sujok, both working very fast. Now remember one thing, whenever we are telling anything work very fast, like missile is very good, missile is very fast. It means you should know how to project the missile. कि मिसाइल बहुत तेज काम करती है ना, तो मिसाइल बच्चे के हाथ में दे दी तो क्या हो जाएगा? सोचिए, वो कहीं भी गलत उड़ा दाग देगा मिसाइल, है ना. तो मिसाइल बी द EOV like a missile. Why this missile? Suppose I'm telling you, okay, BP is high, then you should know what to do in the high BP. Spleen 4, pericardium 6. Suppose person is already having low BP and you are doing this, what will happen? You can think what will happen. Then person will go in the hypotension. So we have to be very much careful for our proper diagnosis. Like one lady came to my clinic and she told me, doctor, and she told me, doctor, I suffer with low BP all the time. Okay, you suffer with the low BP. Okay, believe the patient, but never believe patient 100%. Then the lady fall down in front of me and she got chest pain. Maybe she got the heart attack. Even I was going to start the treatment. I didn't start the treatment. Then I asked again with the husband whether she is having tendency of the low BP or high BP. The husband told low BP. But I thought whether I should increase the BP or decrease the BP. It's a very big question because my heart is saying I should decrease the BP. But patient is telling I'm having tendency of low BP. Are you getting my point? Are you getting my point? What I want to now. Quickly I checked the BP. It was 220 by 140. You can understand. And patient told me I'm having tendency of the low BP. Then immediately I put a spleen 4 on the right side, because right is the dominant side for female, pericardium 6 on the left side, and seen quick results, quick fix. So now, in this way, want to treat the diarrhea, okay? Want to treat the heart problem, want to treat the chest congestion, want to treat anything which is in the chest. It's a very wonderful combination. Spleen 4 and pericardium 6. Very quick, but make sure patient is, your diagnosis is perfect, right? Your diagnosis should be perfect. Then you can treat this point. Now let's see the another combination. What is written here? Gallbladder 41. Gallbladder 41 is called belt of the human body. हम belt कहाँ लगाते हैं? हम belt कमर में लगाते हैं. We are putting the belt in the like best area. So gallbladder 41, belt meridian or the diami, and the triple worm of 5. Now look at what's written here and read it very carefully. Person is having problem in the cheeks, maybe numbness, maybe pain, shoulder pain, problem in the diaphragm, so having breathing, breathlessness, lower back pain, ear problem, and the problem on the outer side of the eye. We can see the quick results if we apply these points. Apply these points, right? So we have to be very much careful. Gallbladder 41, one of the great points for shoulder pain. I will tell you, sometimes shoulder pain become very challenging. For some patient, we can fix the shoulder pain very quickly. But for some patient, sometimes it become very challenging. So gallbladder 41 is one of the great points for the cheeks problem, ear problem, shoulder pain means the problem on the side. अगर हमारी साइड में कोई भी प्रॉब्लम है, हम गॉलब्लैडर 41 से बहुत शानदार ट्रीटमेंट कर सकते हैं. And the lower back pain, I will tell you, if the person is having lower back pain, we will discuss this thing tomorrow, but I will tell you today also, if the person is suffering with a lower back pain in the left side, अगर एक किसी व्यक्ति को lower back pain है, especially on the left side, as soon as you put the gallbladder 41, lower back pain will go away. अगर किसी को कमर में दर्द लेफ्ट साइड में, आप लगा के देख लेना, आज ही किसी को लगा के देखना, आपके घर में हो किसी को कमर में दर्द है, लेकिन कहां पर? लेफ्ट. राइट के लिए थोड़ा और कुछ करेंगे, कुछ मत करना. गॉलब्लैडर 41 को सुजोग में दबा देना है, मेथी का दाना लगा देना, स्टार मैग्नेट लगा देना, टॉनिफिकेशन कर देना ऑन द मास्टर साइड. व्हाट इज द मास्टर साइड? लेफ्ट फॉर मेल, राइट फॉर फीमेल. See the quick result. If the person is having lower back pain, and if you put the gallbladder 41 for the left lower back pain, it will take hardly 1 minute, and you will see the quick result. But remember one thing, when I'm telling 30 second, 1 minute, 30 second, 1 minute, my intention to tell you the starting of treatment. Don't think now pain will never come back. We have to work very properly for few days. हमें एक प्रॉपरली काम तो करना ही पड़ेगा ताकि उसका रिकरेंस ना हो. So the person is suffering with the shoulder pain, you can try this point. It's a wonderful point. The problem of the diaphragm. What is the problem of the diaphragm? Diaphragm की प्रॉब्लम क्या हो सकती है? Diaphragm की biggest problem is breathlessness, breathing disorders, asthma. Because diaphragm is the respiratory muscle. Diaphragm is the chiefest respiratory muscle. हम सांस लेते छोड़ते हैं तो डायफ्राम की मदद से तो लेते हैं. डायफ्राम is helping for breathe in and breathe out. Definitely hiccup is the issue. Hiccup is the problem because of the irritation of the diaphragm, because of the irritation of the phrenic nerve. But normally if you see the diaphragm play very, very important role. In the osteopathy, we have seen the diaphragm can create many other problems, right? Right now, we are just thinking in a acupuncture way. Diaphragm is the dome-shaped structure here. Diaphragm हमारा dome-shaped structure है यहाँ पर, और it's a chief respiratory muscles. ये क्या है हमारी? ये हमारी chief respiratory muscle है diaphragm. एंड विद द हेल्प ऑफ डायफ्राम व्हाट वी कैन डू, हम डायफ्राम की मदद से हम क्या कर सकते हैं, हम डायफ्राम की मदद से ब्रेथलेसनेस को ठीक कर सकते हैं, अस्थमा पर वर्क कर सकते हैं. So look at here now. So shoulder pain, diaphragm, lower back pain, just I told you, ear problem, Kaneki problem, and the outer canthus. The problem of the outer canthus. Now look at here, the third couple SI3 and UB62. अब हम SI3 और UB62 की बात करते हैं. We are not going in the deeper detail right now. Just I want to tell you the effectiveness. So let's see here. Neck pain, quick fix. Ear problem, shoulder pain, back pain, quick fix. So we can see the quick fix with the help of SI3 is the very good point for the spine problem, right? So in this way, there are the four couples given in front of you. The person is suffering with a throat problem, chest congestion, and the lung problem, LE7 cases. But you have to understand many things very clearly. आपको बहुत सारी चीजें बहुत clearly समझना होंगी. So tomorrow we will discuss some correction of the extraordinary vessels in Hindi, master point and the couple point, how to treat the various body areas, and many more things. Enough for today. आज के लिए इतना काफी है. So recording will be given as soon as possible. Thank you so much. Let's close the session and see you tomorrow by 7:30.